End of October as we welcome Dr. Steffany Mohan here from Plaza Dental as we need a couple of things we need to take care of. Number one, we need to get an update on how Jackie's 6-month smile is going.
I know.
And then we're going to talk a little bit about sleep apnea and, yes, believe it or not, a dentist. Might be able to help you with that.
Yeah.
All right, let's talk about her.
I was just recently on a trip, and it was so fun because I would talk to friends I haven't seen forever and a day. And of course they follow me on social media, but for the most part they haven't seen me. And
they don't watch you every day?
No. And they should. In New York and various places, and I would talk to them, and at the end I'd be like, hey, did you notice anything different? And they'd be like, no, why? And I'd be like, ha ha. And they're like, oh, you have braces on. I'm like, yes, I do. And you don't even see it that they're there. So yeah, very, very cool. Continuing on, going on. I'm gonna only have a couple more weeks and I'm already gonna be done.
I know.
Believe it or not.
Totally done.
But we just wanted to show you a little bit of a follow-up of what happens when you have these guys and they just replace, well, you explain, Doc, what's going on, but you replace
I mean,
the wire.
You know, the sharp instrument is not pointing toward anything vital, so that's really good. And
no, is that you doing the work?
It's actually, this is one of my assistants doing the work, so I was there. I was present.
Supervising.
Yeah,
she was supervising, but they put in the last...
put in the wire.
Oh, God, that's a wire. I thought that was a big needle.
Oh, no, it's a wire.
No, they put the last wire in.
You do have a little dental phobia, don't you?
Yeah, I do.
Yeah, okay.
Do you really?
Yeah.
Oh, that's funny. So they put the last wire in, hooked me up, and I should have one more round of this bad boy, and my bottom teeth are going to be completely straight like this.
Now, to be clear, you're not required to smile for 6 months, right?
This is no, that's the whole point. You have to smile for 6 months.
And also, something, I apparently ate something a little too hard, so I lost one of my brackets, which you said was pretty normal. So
that's pretty normal.
It took like 2 seconds to throw a new one on there and
now,
get it
how
ready
do you you weld these on her teeth? What do you do to these?
No, it's bonding with dental cement. So yeah.
Not a big deal, but going along really well. I'm going to be done here before you know it.
There you go. Perfect.
Yeah.
Wonderful.
Yeah.
All right, now we're talking about something that a lot of people actually do have, but a lot of people don't really realize it at times.
Yeah.
What are you looking at her teeth again?
Yes.
We're talking about sleep apnea, and this is something...
I can't imagine you guys get distracted ever. I mean, you know.
No.
It's only a 4-hour show.
Never.
Yeah,
but sleep apnea is something that it really is can be very serious.
It's very serious. It's funny too because as dentists, you know, we get really focused in on the teeth and you know how they look and how they're functioning and if there are holes in them and that kind of thing, and we really forget that the area that we work in is where people breathe and where they, you know, a lot of functions take place right in the mouth and in the face. And
it's kind of a life-sustaining area.
It's a pretty life-sustaining thing, yeah. It's kind of where we live, really. So, but yeah, sleep apnea is something where a lot of people don't visit their regular physician, you know, every single year or whatever, but a lot of people do visit their dentist every 6 months or every year. And so we can do a lot of screening and just talking to people about how they feel when they wake up, if they're, you know, if they wake up tired. I'm sure you guys all wake up tired because you wake up in the middle of the night. There's a lot of different symptoms that go along with it.
Explain what sleep apnea is.
Sleep apnea is when people stop breathing at night. So when they're sleeping.
For seconds at a time.
For seconds at a time, right. But a lot of people, I mean, people with sleep apnea sometimes stop breathing 50 or 60 times for seconds in the middle of the night.
So you're losing oxygen.
You're losing oxygen. It's very difficult for your heart. It puts so much pressure on your heart. So a lot of people that have heart issues and there's really no earthly reason why, a lot of it is from pressure from sleep apnea. So I mean, you know, the pressure on the body and the stress on the body.
So say that again. People can have heart problems because of basically snoring and not breathing.
Well, imagine if you stop breathing at night and your body isn't getting oxygen, it harms everything. It harms every system that you have. So it's very, very stressful on the body. It's very difficult for the body to kind of recover from that.
Now, that image that we had up on the screen, what exactly were we looking at?
So a lot of people that are diagnosed with sleep, so the first thing is you have to be diagnosed with sleep apnea, which means that you wear a little apparatus when you sleep that tests whether or not you can, you know, you are breathing normally during the night. A lot of people do. A lot of people don't. I mean, probably the statistics are probably half the population actually doesn't sleep well or has some sort of sleep apnea.
And they don't even probably realize.
And they don't really probably even realize it, except for that there are these symptoms where they wake up, where they're, you know, they wake up tired, they fall asleep sometimes during the day, they feel like they need a nap. They just, I mean, they just don't feel really well. And then of course it leads to other things, you know, like sitting because you're tired and that kind of thing.
Sure.
So, like inactivity. But so the what we're looking at is a sleep appliance. Most people that are diagnosed with sleep apnea have a C-Pap, which is a mask that they wear that forces oxygen in to the airway while you're sleeping so that you can still breathe and you get oxygen during the nighttime.
Right.
The sleep appliance actually does effectively, it opens the airway, because what we're mainly talking about is called obstructive sleep apnea. There are some other issues as well, but the main part of the population has obstructive sleep apnea, which means the airway isn't open all night long.
No, so it opens the airway with pressure, air pressure.
Yep, CPAP opens the airway with pressure, but people say that it's like sleeping in a tornado because it's forcing air into your airway, into your nose and into your mouth, and so you can breathe. And so the sleep appliance simply opens the airway, it kind of pushes forward the airway so that you can actually breathe. And
it looks like a kickstand for your teeth.
It's interesting.
And so you lock it in place when you go to bed?
So it's an alternative. It's an alternative to people that either can't or won't or don't wear a CPAP machine. A dental appliance is very, very, very reasonable, and people like it much better than CPAP.
Might seem more doable.
It's more doable, right? Compliance is our biggest issue. Compliance with CPAP is an issue. Compliance with, but literally we're talking about life and death. I mean, there are people that they have an episode and they don't realize why.
Wow.
Now let's answer the obvious question here. What if you have insurance? What type of insurance?
Actually, medical insurance sometimes will cover these.
They will.
Which is really cool.
And you guys have all those answers?
Yeah.
Well, you think it would be in their interest to cover. It's a lot cheaper than handling a heart attack.
Yeah, absolutely. Right. Absolutely, yeah. So I mean, essentially, if people should just get screened. I tell a lot of patients to get, at least if you think that it's possible. That
now, is this where you have to go in and be tested?
Yep. There's a home sleep test, and then if you fail the home sleep test, then you go and you have.
We did this years ago, and I have a CPAP machine at home.
Yeah.
So, it's one of those things. Wow. But to be honest with you, I don't use it very often.
Right.
Because it's a pain.
It's a pain.
Yeah.
Right, it is. So popping in something into your mouth is a little easier, and that's the whole point.
Okay.
Wow. So whether it's cleaning, straightening, or possibly saving your life using something like that.
And it's interesting because, dentists are looking for a lot more than you think they're looking for. So, but sometimes it's asking the right questions, and sometimes it's telling them the right things that are going on in your life too.
Well, if people have those questions, how can they get in touch with you, Doc?
Our easiest way is dmsmiles.com. Most people come to our website and look at that, but we have phones too. So.
Technology.
612-7148.
Yeah.
Perfect. Wonderful. Good job. Thank you so much.
Thank you.
All right. It's 9:21 right now. We'll be right back. You're watching Great Day Live in Des Moines.